fixed the things that could be fixed at the Board of Medical Examiners. We went after the people who are doing bad things. We undid a lot of the fraud and streamlined the process for licensing. And after we'd fixed everything we could fix, people were still attacking us. And so I said, well, we have a lot of people who come here from the best institutions in the country because Las Vegas is a desirable place to live for a lot of people. And they would love to be practicing here exactly the same way they were practicing 2 weeks ago. We identified the primary problem is the structure of the health insurance markets. They're primarily run by publicly traded firms. And the CEO of a publicly traded firm has two incentives. Number one,
if you were elected, what would be seemingly different for families in Nevada?
Well, hey, I'm Dr. Aury Nagy with the Dr. Nagy Show. Today we have on Jeannie Mai, who is with us today from a company called HelpGrid, where she is the CEO and has been connecting people with the products they need for over 6 years now. And she's come to Las Vegas and is going to talk to us about what it would take to bring her business here to Las Vegas and more of the employees here, and what it would take here in Nevada to improve education here in our state. Thanks so much for being with us today, Jeannie.
Thank you, Dr. Nagy. Thanks for having me.
You betcha.
Was there ever a time in your life where you thought of not being a doctor?
Oh yeah. I was going to be a philosopher, actually. That
was
my original plan.
A certain side, is philosophy just like an overall big field, or is there a certain subset that you would focus on?
I just thought, we should try to live our lives to do something good and help other people. And I figured, philosophy was the way to go to figure out what the right thing to do was and how to, how to help people. And I took a course at Harvard one summer, and within the first 3 weeks, the guy quoted, I think it was a philosopher named Williams. In 1950, he had said everything that's ever been said in philosophy, everything that's ever going to be said in philosophy has already been said. And so, and of course that wasn't true, but I kind of took that and thought about it. I said, I'm not Gandhi, I'm not Jesus, I'm not Buddha. What are the odds that I'm going to contribute meaningfully to this field? So I said, instead, let me go and look at economics and sort of figure out how people should use the resources they have in the best way possible to help as many people. Because that's something I could probably more practically help with. And so then, so when I went to college, I was planning to be an economist, and I was kind of studying the medicine prerequisites just as a backup in case, right? And about my third year in on economics, I came to the conclusion that most of economics was BS. and was just used as a smoke screen cover to justify whatever policies the government had in place or whoever was in leadership. So if you wanted to have a career in academics and be successful, ultimately you had to shape whatever it is you were writing to whatever leader was in the power at the time.
I can relate to that in some way. I actually so I went to UCLA for economics.
For economics?
Yes.
Really? Oh, I'm a fan. I'm a big fan.
So I was only there for I was only in the program for 3 years, and then certain things happened. It's an excuse, right? My dad passed away.
Oh my gosh.
I stopped caring about school. I was like, my mom understood. We were immigrants. She didn't speak English, and she's just like, I'm at a loss. I don't know what to do. You go figure it out.
Help mom?
I tried to help mom. I was a server, a waitress, and then the school, of course, saw my failing grades because I didn't show up to any of my finals, and they're like, so are you, you don't qualify for this degree or this field anymore, so either you're going to have to change or you're going to have to drop out. And I had financial aid. I'm like, I technically just have 1 year left. Like, I feel like I can do it. Let me choose the quickest thing I can graduate with, and I chose Asian American Studies.
Oh, wow, okay.
It was very eye-opening for me. I used to kind of scoff. In the beginning, I would scoff at a lot of the type of prompts that we had to write. And what I realized, I'm like, you can BS your way through this. All of this is just about who can write very well and defend their point. So you just have to choose a point and then try to defend it. And I would think, I would say I credit a lot of my critical thinking skills to being able to BS my way through the last year of school and bring those grades up. I tried to then jump into nonprofit work.
Okay.
And what I learned, so going back to economics, the parts of the reason why I didn't want to try is when I was in that class, a few things. In there, I always felt like I meant to run some type of company or be an entrepreneur. When I sat amongst my peers, I'm like, I cannot relate to everybody. Everybody felt like a shark. And then a lot of the members or a lot of my peers also didn't actually live in the States. I was competing with kids from overseas with different resources, and so it was always skewed. So I'm like, what's the point of this? I don't have the resources to compete, and I don't think in this way. Maybe money is ugly. And then when I got into nonprofit, what I realized is you want to help people, you also have to beg people with money to help other people, because most of these programs rely on the government, and it's a cycle in which there has to be enough people in need that use those resources so that the government renews your funding. And then in the meantime, you go throw galas and fundraisers and beg people with a bunch of money to help others. And so I think after trying to do that and doing it practically for free and my mental health at stake, I'm like, you know what? I think the best way I can help people is just to make my own money and then decide how I deploy those funds.
Right.
Yeah, and so I think now we caught up on this timeline. I was talking about how I came to Vegas. I was only going to be here for a short time and then move to Bali and just like leave my life behind. Okay. But then my friend was in a murder-suicide, left her 2 children behind. Yeah. And so I ended up financially taking care of her kids. My partner left his life behind in California to help with kids he's never met. I ended up taking care of her parents I wouldn't say taking care of, they came because they want to be with their grandchildren, but I had also never met them. So now I have this weird family dynamic in the house. And then it goes back to, in order for me to help everybody, I have to also make more money than before. And so I would say...
all of a sudden, too.
Yeah.
Wow.
Yeah, and I never planned on having children, nor did I plan on ever getting married. And now I'm married and I technically have children.
Congratulations.
Yeah, thank you.
How long ago did that happen?
After my first year here, so it's been 5 years.
All right.
Yeah, the kids were 14 months and close to 3 years when it happened, and then now they are 6 and almost 8. Mm-hmm. Yeah, so a lot has happened. How about you? Do you have kids?
My kids are grown, so they're one's in grad school doing computer science and mathematics, and the other one's doing medicine.
Oh my gosh,
so,
great!
Yeah.
I don't even know how to fathom that, because for me, I'm just hoping. I hope that they are mentally well, sound, and cared for before I even put any wish or hopes on them.
Yeah. Well, that's a great hope, though, right? It sounds like you're going to raise really great kids.
I hope so. And so, it comes into kind of like the conversation that we can have today. I really care about their education. Mm-hmm. And I would say I feel concerned of the type of education and resources I had, even as an immigrant child in Orange County, that it feels very different here. I asked my partner, I'm like, why does it feel that the schools just never have enough money? There's a fundraiser every week, and it just seems like the school is running dependent on parents' donations or even local businesses' donations, as in like you pay a chunk of money to the school, they'll advertise your business on an elementary school playground.
Yeah, and we're supporting the local debate teams over at Palo Alto for the same kind of reason. I mean, just to help them function and provide a nice activity for the kids in high school.
And so you getting into politics, what is the reason you do pretty important work as a neurosurgeon already?
I was at the Board of Medical Examiners. Mm-hmm. I saw it was broken in the healthcare system, and I was in a position where people started asking me for answers. Mm-hmm. And there were a lot of people, particularly like at the Chamber of Commerce, who were like, well, healthcare is broken, and they wanted to know why they were unable to recruit top candidates to Las Vegas. And the candidates would always say, well, the healthcare is terrible and the education is terrible. Mm-hmm. And so these executives would then go ask their peers, well, what's broken? And who were their peers? Well, it wasn't doctors, it was the CEOs of the health insurance companies and the hospitals. And those folks obviously aren't going to own their problems. They're going to it's these doctors. Yeah. So the uniform thought for most of the leadership in the country was, well, the healthcare problems in the state are due to the doctors who are here. So we came under criticism. So we fixed the things that could be fixed at the Board of Medical Examiners. We went after the people who are doing bad things. We undid a lot of the fraud. We made the streamlined the timeline for complaint to adjudication, and streamline the process for licensing.
Yeah.
And after we fixed everything we could fix, people were still attacking us. And so I said, well, we have a lot of people who come here from the best institutions in the country because Las Vegas is a desirable place to live for a lot of people. And they would love to be practicing here exactly the same way they were practicing 2 weeks ago. So why aren't they practicing here now exactly the way they're practicing over there? And the answer is because of the institutions in which we have to practice and the regimes that are implemented on these systems by the insurance reimbursements. And so I started very aggressively attacking those institutions and blaming the Chamber of Commerce for being not being bright enough to understand that that was the reason. So when I kind of aggressively blamed them for the problems that we have, first they got mad at me. But then they realized I was right, and they redirected their anger and aggression towards those institutions that are, really putting profits well ahead of the benefit of patients. And as I started addressing these problems, I went to the legislature to try to get laws passed and supported that were benefiting patients and the healthcare industry. And what I saw were lobbyists from the health insurance companies, hospitals, the pharmaceutical companies, the hedge funds that practice medicine, the personal injury attorneys, and they were very well funded and very very savvy, and they were able to year after year get bills passed in the favor of these corporate interests rather than in the interest of the people who live here or the people who take care of them. There's almost no lobbyists for that group. So so I saw year after year that happened. I thought every year in the future that's going to just get worse and worse and worse, and we're going to have fewer and fewer rights and protections. And so I didn't know what to do for maybe a month or two. And then I came across an article written by an economist over at UNLV, and he pointed out that there are 150,000 people in Nevada who work in healthcare. Well, a state of 3 million, that's 5% of our population. And if they all have a significant other, that's 10%.
Yeah.
If all those people have one friend who cares about healthcare, that's 20%. If only half the people vote in an election cycle, that's 40% of the electorate. 40% of the electorate, we can get anybody elected anything.
Yeah.
So I started reaching out to create a network. So as president of the Board of Medical Examiners, I called the Board of Nursing and the Board of Dentistry and the Board of Optometry and Podiatry. There's about a dozen of these allied health groups. And I said, are you guys seeing the same problems we are? And people were like, yeah, we absolutely are. I had one nurse break down crying. She was so happy that somebody was finally doing something. Because there's a lot of despair in healthcare, particularly after COVID. The doctors and nurses were in a position where you'd see somebody, and the analogy I use for lay people is it's like seeing somebody drowning in front of you. And you know what to do. You know how to save their life. You want to do the right thing. You reach your hand out to go save them. And then the hospital, the insurance company grabs your arm by the wrist, holds it behind your back, and you have to stand there and watch them drown. Yeah. And that happens day after day and week after week and year after year. And it just kind of breaks people, right?
Yeah.
I mean, so there are a lot, there's a lot of suicide, there's a lot of people leaving the field, a lot of people just leaving the state to go someplace else where maybe it's a little easier and better. And so there was a lot of support for anything that we can do to start putting healthcare providers back at the decision making of what proper health care is. Because all those entities are lobbying, they're trying to say that they're the people who should decide what good health care is. But the only people who've taken oaths to help people, who look patients in the eye, actually care about what happens to the people in front of them, or have a vested interest of their own, like a sense of value and self-worth in seeing people get better. That's the healthcare workers, not these giant faceless corporations that have only one ambition, which is to make more profit than they did the year before or the quarter before. And so we, at first we called ourselves the Scrubs Party because we're scrubs. Yeah. But then literally, after about 6 months, people didn't want to be scrubs because scrubs can't get no love. that was the actual reason. So we had to change the name. So we came up with another name. We decided to call ourselves the White Coat Party because we're white coats. And there's a red party and a blue party, and all we're trying to get done is fix healthcare, so everybody can agree on that. Yeah. And so, and red, white, and blue, right? So it's and so, so we got a lot of traction. I got registered as a lobbyist for the White Coat Party. I went to the legislature and started lobbying on these laws, and started to figure out how we can fix things. So we'd have these meetings once a month for the White Coat Party, and we'd kind of draft a bunch of laws. And the way we do it is we'd say, this is what the problem is. What do you think? Here's a draft of a solution. And we had them on laminated paper, and then people would have markers, and they could cross it out and write something underneath. And the next party, that was the new version. And so we sort of created 30 different solutions. We packaged them in a little booklet and we circulated to as a lobbyist up there the next cycle. And we started to, at least one or two of the laws got passed, and I threatened all the legislators up there. I said, listen, we have these numbers that I talked about, 40% of the electorate. If you guys don't pass bills that improve healthcare, we will remove you from office and run somebody from our own ranks to replace you. And so this legislative cycle, there were more bills written to improve healthcare in our state than we've ever had in a single session. Because, they were intimidated, right? So we had a voice, was the point. Yeah. And so in the course of doing this, we kind of came to figure out a plan that we thought would fix healthcare in Nevada. We identified the primary problem as the structure of the health insurance markets. They're primarily run by publicly traded firms. And the CEO of a publicly traded firm has two incentives. Number one, go to all the employers in the state and charge the max amount of money you can extract. Okay. Number two, provide as little care as possible. To the extent they maximize both of those two goals, they maximize profits of the company, shareholder valuation, and the CEO's profits. But that's obviously not in the interest of the patients. And we compared that to the way healthcare used to be run. In the 1980s, when we had the best healthcare in the world and it cost less than half of what it costs now, it was all run by mutual insurance companies. So the CEO of a mutual insurance company still has to negotiate with the hospitals, doctors, pharmaceutical companies, but there's no incentive to deny appropriate care, because if they deny appropriate care, the people who own the company, the mutual insurance policyholders, or the patients, who are the people who own the company, they will fire them. So now the CEO is accountable to the people they're serving. And so now their objective is to provide the highest quality care for the lowest possible cost, exactly aligned with the patient's incentives. And the interesting thing about mutual insurance companies is if they make a profit in a certain year, then the next year, instead of just taking the money from the patients to give it back to them in dividends at the end of the year, they just reduce their premiums. So you can institute this policy and actually see premiums fall instead of go up every year like they're doing now.
So is this conceptual or is this actually in practice? Because I can't tell you that it looks like my premium has decreased ever.
So most people are getting their health insurance through a publicly traded firm. And so those companies have no incentive to ever decrease premiums for anyone. But we are seeing this taking place in the through the unions. Okay. So recently, you're seeing a lot of protests against the Valley healthcare system, and that's from entities like some unions like culinary and the policemen and the firefighters and the teachers and several. I think there are 27 different organizations that are part of this group of self-insureds, essentially. And so they're local entities that have done. They're doing essentially this. They're doing it on a union basis. We'd like to see employers be able to group together to purchase healthcare in exactly the same way. And there's a couple organizations here right now that are putting this together.
So has there been a big overhaul in practice yet, or are we still what stage are we at?
So we're trying to assemble the teams of that can execute on these mutual insurance companies. So I've got a guy who used to work for CMS. I have a guy who used to work for Kaiser. I have a guy who used to work for, who's built several mutual insurance companies of other types. And we have another guy who's an actuary who's been around in risk assessment. And so we have a lot of the tools that we need to execute on it. And we have a large group of salespeople who want to be part of this should we succeed. And we've shown the governor here and the guy running for governor Republican in Arizona, Andy Biggs, how this can be used to leverage both political power and donations for both the governor's candidacy, but also for all the downstream ballots that he needs to get elected in order to implement these policies at the state level. And so we're hoping that they can have success with this, and that there's a tremendous surge as all of the corporations in the state want to see their healthcare bills go down. All the patients want to have improved care. All the healthcare workers want to be able to work with a system that's not so adverse to the patients they're taking care of. And so it's a win-win-win for everybody, except for the gigantic health insurance companies. And so it'll prevent hundreds of millions of dollars from being siphoned out of Nevada to be sent to Wall Street, where it goes to investors in China, Russia, Saudi Arabia, the central banks of Europe. Instead, that money will stay here. Hundreds of millions of dollars will recirculate in our economy. It'll be great.
Again, idea sounds great. I think a lot of it is visibility and accountability, at least same thing within our organization. I can plan that we're going to make X amount, but it really depends on the people to execute it and having visibility to make sure that each stage gets done. So it sounds like you have the resources, the ideas are sound. How do we as constituents ensure that in this grand scheme of things that we're making the progress that was promised? Like, do we have to wait 2 years, 4 years before we see that? Or where does it get published that we know we're moving along and that funds are being used the way that you intended?
So the structure that we're engineering is one in which all of the financial incentives are pushed towards engendering this process. So it's not like you're forcing anybody to do anything, but you're creating those incentives that will allow the markets to pursue this decision. So every state has the ability to license insurance agents and to provide permits for insurance companies, meaning that they have the ability to regulate these people. So for one way that this could be achieved is they could just put a tax on the sale of health insurance. And the tax could be like this much. And the tax is forgiven if you're a mutual insurance company. Now every employer in the state will shift their insurance plans to the mutual insurance companies. And so you'll see these mutual insurance companies be able to succeed and the giant publicly traded firms will struggle. And as we're able to diminish the death grip that they have on the healthcare markets here in the state, a lot of the monopolies that they hold here that have allowed them to manipulate prices to their advantage will fall apart. And we'll see prices start to approach more what they should be in a free market. And they should fall as the quality of the goods increases.
I love your ideas. You know that many of the big corporations probably don't love your ideas.
The big insurance companies don't, but every other big employer in the state will love them because we're going to save them a ton of money.
I mean, even talking about, it's a little bit off tangent, not talking about healthcare, but like monopolies. What about NV Energy?
Right. So, I have my own beef with NV Energy. I'm kind of mad at them still about what they did to the solar industry here. When Berkshire Hathaway took over the solar industry here, or the energy industry over here, they went after the solar companies. And they, for whatever reason, suddenly if you had solar panels on your house, the cost of your electricity was more than it was for people who didn't have solar panels. And that was nuts, right? There's no reason except to be punitive and to suppress the further development of the solar industry here in the state. And so they drove a lot of solar companies out of business at that time. They did that here, they did that in Arizona, and they did that in Texas as well. Here, Arizona, and Florida. And because that's where they bought power companies. And the legality of all of that, for whatever reason, it was Governor Sandoval at the time, and he allowed that to happen. Maybe they threatened to sue the state and argued that the state hadn't adequately projected in their 30-year projections the increase of solar and that therefore it was a fraudulent deal and they'd bankrupt our state in the lawsuit because they're Berkshire Hathaway and we're just the state of Nevada. I mean, maybe that's what happened. I don't know. But for whatever reason, our government allowed Berkshire Hathaway to destroy the solar industry over here. We were the #1 residential solar installer at that time. I had a company called American Patriot Solar Community. And I built it not because it was a revenue generating thing. We were profitable a little bit. But we developed it because when I came back to Las Vegas in 2004, I drove around the city and I realized we had more days of sunshine than anywhere else in the country. And I was like, how come we don't have solar panels on every roof out here? So I said, these contractors, somebody needs to do something about it. So 2005 goes by, 2006 goes by, 2007 goes by, 2008 goes by. I'm like, come on. This is ridiculous. How come nobody's doing anything? And then I was like, I've got a degree in economics from Yale. I can do something about this. So I, grabbed the pencil and paper and I sort of penciled out, how much would it cost to buy these in bulk and to do the installations and to do the advertising for it and to pay the sales staff. And then, how much can we get back in rebates from the government? Because you couldn't do it at all, and that if you didn't get rebates, and then how much would it cost to roll that cost into a home loan, so that the monthly payments on the debt on that are actually less than the cost of electricity. And if we can do that, I'll open. Because then we're actually providing a service to people, not just selling panels. We're lowering their electricity costs, and we found out that we could do that. We had to pre-package, we had to get 13 sales of 5 kilowatt homes to pre-sale to have enough panels to buy an entire container. And then the prices were low enough back at that time. And so we opened the company and we had 40 contracts we were able to get because we did this great advertisement with Uncle Sam. I want you to get these rebates, right? It was great, and then we got 0 rebates. So they're supposed to be random in 40. And I think only like 50 or 60 were given out. So how could we not get a single one of them, right? So we went and got some attorneys and kind of looked into it, and all of the rebates have gone to one company, either directly or through like straw companies that have been set up for them. And so, that wasn't fair. And they were charging 2 to 3 times what we were charging for the installations. And so, unfortunately, the attorneys we worked with were able to break that monopoly and break that, whatever had been done to make that happen. And the next year, things were fair, and we became the #1 residential solar installer in Las Vegas. Shortly thereafter, a bunch of companies opened up, got into the market, became very hot, and that's just what we wanted, right? Just what we wanted was suddenly there are going to be solar panels on all the homes out here. And now it's a booming industry here in Las Vegas, right? But it took breaking the group that had a death grip on the allocation of the rebates. And so that was really one of the first instances in which I had to combat a large organization that had control of our government and was restricting the flow of the free trade and commerce to the detriment of the people. And by beating it, we're able to restore something of value to the whole community. So I had to do that a couple times, actually. We had to go up against the federal government when we got into the federally qualified health centers. So that one, so you know how they have all the fraud that's going on in Minnesota right now?
Yeah.
So there's federal money and it gets in there, and really kind of everybody knows what's
How
going on.
does that happen though?
People
Unchecked power?
People get addicted to the donations and the money, and then they just get used to not saying anything. And then how people get when they're getting free money and they feel like they're entitled to it. And then like the minute you start to go and tell them what you're doing is wrong, they're offended as though you're doing something wrong because you caught them stealing. And if you ever had employees who steal from you, but that's the pattern, right? So they scream louder than anybody because they're caught doing something wrong. And so same thing was going on with these federally qualified health centers. They'd give like $2 or $3 million to these entities, and then the administrators from the federal government would ask for kickbacks. And they'd take the kickback and send it all the way back up to DC. And if you didn't, well, for them, it suddenly became like a life and death thing because you were somebody who was opposed to their whole system of graft. So when we refused to pay the bribes for that, they tried to have me thrown in jail, actually. So they threatened me with a 10-year prison sentence. And they had, manufactured a bunch of charges. I knew they were false. So, and when I went to attorneys, they're like, listen, these people are only coming after you because you're resisting their activity. Just walk away, let them run it the way they want to, and they'll drop the charges. And I was like, yeah, no. So the next morning I went to the FBI, and I said, listen, there's a racketeering operation that's going on here and in every FQHC in the country, and you guys need to go and investigate them. And within 14 days, the OIG dropped the charges against me because, of course, I was right. Yeah. And so then it became just a vicious, bitter feud with the people in DC, and they tried every dirty trick you can think of to sabotage our operation. But what were we able to do? We were able to create a healthcare clinic in an underserved area and provide a lot of care to a lot of people who needed it. And we were able to pass that along to another group that took it over, and they kept it doing good. And that was the purpose, right? Yeah. It was not my mission to do it forever, but to provide this, and because we did that, 14 other entities applied the next year to do the same thing. Yeah. Right. And so that's the goal, right? That's was to show people this is how you do things. And I started to lecture around the country on this is, there are lots of doctors out there who try to open charity clinics. Are very happy with they're very grateful for the success of this country, particularly immigrants, right? They're very grateful for the success that this country afforded them, and they want to give something back. So they open these charity clinics. And so I was kind of going and saying, listen, not only does the government want you to, but here's how you do it, and they can help amplify the work that you're trying to do. So do it this way, and do it the right way. Don't pay these bribes like everybody else is doing who's currently operating them. Do it in the right way, and help the government achieve its mission. And so I got to talk to Victoria Seaman recently. Victoria Seaman was our city councilwoman. And she was appointed by Trump to go work for Health and Human Services, wherein she will oversee the operations in Nevada and in 12 other states. And so I kind of outlined her, this is what happened, this is what these people are doing, probably still doing currently. And so hopefully she could turn that around and stop a lot of fraud from happening in our state.
You seem to have a long history of fighting these uphill battles, winning as well. How do you, I guess, protect yourself mentally? And I think it's kind of ironic that I say that because you're also a neurosurgeon, right? Dealing with what many people would think is extremely hard, not as gratifying for the amount of work and legal process that you have to constantly jump through.
Yeah. Well, it got very vicious during COVID, right? We found a generic drug that was effective in COVID. And I found myself at war with the dean of the medical school. He was going around the city telling people, is at war with us. We found a generic drug. We're like, use this, save lives, stop, We had a 68% reduction in mortality, 37% reduction in length of hospital stay. And the hospitals pulled it off the shelves. And UMC refused to give it to their patients. And I was like, what is going on? So we presented to BARDA, the FDA, the NIH. I had people tell me, Aury, if you keep this up, somebody's going to come after your life. And I was like, well, I think we can find a way to avoid that. And so we found a way to present what we were doing in a way that wasn't a threat to U.S. interests. We were able to have an audience, and with people from USAID actually called me to ask me, and I didn't know what USAID was at the level that it is. I just knew it was some government organization that was doing aid work in Africa. But we're still here. And what I reason is that even if you're fighting, very big organizations or either the governments or big corporations, there are people. Those organizations are made up of people, and there are going to be people over there who also, they have kids. They want to see a good future for their families, and they know the difference between right and wrong. And when they see somebody who's doing something right that's going to help their kids downstream, or the people in their community, they'll find a way to leave a little door open for you, or to kind of help you in a way that's not going to cost them their career or their job. And so when you're in these fights, you keep your eyes open for that kind of a thing, because more often than not they pop up. Not always, but more often than not.
So now let's talk about families. If you were elected, what would be seemingly different for families in Nevada?
Well, if we succeed with this healthcare bill, and I succeed in stopping the insurance companies from destroying what we're able to build over here, what will happen is the average income for every family will go up, because they'll have to spend less on healthcare. So right now everybody's seeing their healthcare costs dramatically increase, right? So that should reverse. We should be able to restore 8 to 10% to America's gross domestic product. So that's like taking a tax down on every man, woman, and child in the country, and being able to use those resources really for whatever America needs, rebuilding our infrastructure, building our roads, securing Social Security indefinitely, paying down the debt, whatever the president and the Congress decide is the best use of those funds. And so that would be like our economy is running on jet fuel. I think that's what the average American would see, and how it would help the average household.
Okay, so if people have more spending power, how does that change the economy of Nevada? Would it attract more people? Would we build more? Would we see more local businesses instead of big corporations trying to get tax incentives here?
When most Americans have more disposable income because they're paying less to the giant health insurance companies, they can travel and they can come and enjoy themselves here in Las Vegas, which is what Las Vegas is about, right? We're here on tourism, and when America's economy suffers, tourism numbers go down. When the economy is booming, we're extremely busy here. We're one of the first we're one of the most sensitive indicators on what the American economy is doing, actually.
I don't have the numbers around this, but we don't pay state income tax in Las Vegas. I hope it stays that way. I know there's a lot of money in taxes that are coming from the casinos. And going back to a conversation that you and I just had, like in the beginning, about like education, how is Nevada, specifically Clark County and Las Vegas, how is our education system ranked so low in pretty like a low, like there's only a few cities here that are very populous, right? And yet we have a lot of money from the casinos. Where is that going? Why is it not going back into the education system?
Yeah, that's a really great question. I think, and particularly, when marijuana was legalized and they generated all this revenue from the tax, that was all supposed to go directly back into education, as I recall. And there's a lot of question as to where did that money actually end up and get allocated, and how come we haven't seen those improvements. I'll say over the last couple of years, since Lombardo's been on board, they have started to see some improvements lately. He instituted some plans where they increased accountability for the schools and tied their funding to be able to demonstrate that they're meeting the metrics that they need to. and we've started to see schools trying. As a matter of fact, the number one high school in the country is now here in Las Vegas. It's up the street all the way down Charleston.
Is it a public school or charter school?
It's a public school. It is a magnet school.
Okay.
And so, which is really amazing. When I was here in high school, Clark County School District was number one in the country, actually.
Very hard for me to fathom.
I know. But I was talking to a lady who was president of the school board at that time. And I'm working with her on like a nutrition project in the schools to improve nutrition there, because we have the best chefs in the country, the best nutritionists in the country, the NFL, the UFC, the WNBA, NHL, and freshest food shipped in every morning. So we could be providing the most nutritious, delicious foods in the country to the kids in our schools.
Yeah.
But we recently enlisted a whole bunch of people to help, including people who work in nutrition purchasing and planning at the school district. And that, those people work very hard. It's a very big school district, 330,000 meals a day. Nobody's getting poisoned or dying. They do a great job, but we'd like to see the quality improve, and they're willing to allow industry in from the gigantic food producers, from the best produced food in the world at the Strip, to start to help with this process and provide some of that same quality of food to our kids. And so we're hoping over the next 2 years we see that implemented, and we'd like to implement that in a way that's better than anywhere else in the country. So we create vendors and consultants who can take that knowledge and spread that and those products to the rest of the country, and which resulting in a tremendous amount of revenue for the state.
Amazing. That's what I would like to hear. I would like my kids to eat better at school and be educated on nutrition instead of relying on what is at home, right? Because back then when I grew up in an immigrant family, my parents didn't speak any English. They weren't making very much money. And so they relied heavily on me going to school and learning everything I had there and, kind of coming up independently. And I don't know if I can say that I believe that will happen for my kids here without a lot of mine and my husband's involvement into helping shape the way that they think, and even like things that they eat. I was telling you, like, it's kind of ridiculous to me. I get that I choose to put my kids in a public school instead of a private school because I never went to a private school, so why do they need to? But I do see us having to pay for a lot of fundraisers every week, and certain fundraisers, which I ask the question, is it because you can monetize, or is it because you need to fundraise and because you actually aren't getting money? But some of the fundraisers are like a pizza party or like Chick-fil-A. It's okay to eat that. I just would like to reduce how often that happens, because I think my children should eat more than just pizza and Chick-fil-A, right? So just kind of piggybacking on what you said of like how important it is for the kids to have better nutrition, and it goes hand in hand with the type of education that they have, because technically the kids were wards of the state, part of the foster system because of the tragedy that happened to them, and luckily they have a lot of family that loves them and that I can financially provide for them. But there is a lot of children who are in the foster care system that don't have the same resources as in a bunch of people trying to fight to take care of them. And I think a lot of that goes back to, again, education. When you have a lack of education, you have less opportunities, you make less money, you're probably more likely to get involved into some type of crime. And then when you have children, you don't have the understanding nor the resources to then take care of your children. And then they go into the foster care system where you pray that somebody will take care of them.
You should come to one of the next meetings that we host for this Nevada Nutrition Coalition.
Yeah.
And there's a lot of very bright people working on these topics. There's another group, Village Foundation, that works with some of the most disadvantaged communities in the city. And it's people from those communities who are coming out and they go and they become teachers. They become the leaders of the school board, and they're working on solving these exact issues that you're concerned about. Tell me about like how you got to be so successful from you were a child of immigrants who didn't speak English. You went to amazing college, and then you had to drop out in financial hardship, support your family, and then how you turned that into a success to where you're able to help other people and to now be active in other charities.
Probably not the most professional answer, but sense of delusion.
Okay.
I would say, despite what people have to say about America and our politics, is there is the most amount of freedom.
Absolutely.
And because of that freedom, you have the ability to succeed or fail by your own merit. And because I grew up believing that, I knew that, hey, I may be poor and I may be living in poverty, but if there's a way to get out of it, this is the only place to do so. And that has to do with the resources. My family was on welfare. We were on Section 8 housing. My meals were subsidized. I had financial aid in school. And so I knew to take advantage of that. And like, this is my only way out, because we did not have the socioeconomic status to get out of it. And so I knew if I had the right education, it would increase the likelihood that I would break this cycle. And, despite not actually graduating for the major or degree that I had aimed for, I was at least able to graduate. And, I was able to find a lot of opportunities, because where I lived and even where I am now, there is such a spirit of entrepreneurship. I always ask myself, how do people do it? How do they work at a corporation for 20 years? Like, I just could not fathom it. And in this country, you can make money in any way. You don't have. I think it's great that you went to Yale, correct? Right? You became a neurosurgeon. You serve a purpose, a very valiant purpose. And there are people who are selling cell phone cases that also make a lot of money, and they have that right, and they're able to pull themselves out of poverty. And so, a really long-winded explanation of how I got my success, but I was able to, tap into a basic realm of qualifications or knowledge, but I got by on my delusion and my personality. Honestly, I think a lot of how I got the roles that I did is I was delusional. I was able to sell myself, and they believed in a vision, and I sold them that vision.
Well, you delivered too, otherwise they wouldn't have kept you around.
And then we actually, past the vision stages, now you have to actually deliver, because in our capitalistic society, right, a lot of a measure of success is going to be how much we sell, right? And I talk about like how I care for my community or for people is then when I had authority to make decisions is now, as long as the company meets its needs, I can do whatever. I can hire in certain communities that are marginalized. I can pay people better than the average, right? Or above minimum wage. I can choose to be kinder with people with that money. We serve over, I would say, I think 35 organizations last year. By the way, we're not a U.S. company, so.
Can you tell us what your company is?
Yes, so I run a company called HelpGrid. I've been at the company for...
HelpGrid.
Yes.
GRID.
Yes, that's correct. I've been at the company for 6 years. I became CEO last year.
Congratulations.
Thank you.
Wow.
We started as a call center.
Okay.
And then we built out a phone sales team focused on the supplement industry and the pharmaceutical industry. Okay. And then we build a lot of in-house technology, and now we sell that technology. Okay. Yeah. And so we serve a lot of people across not just the U.S., but across the world.
What does HelpGrid help people with?
Usually, I don't want to give us too much credit because everybody else is the ones who come up with the products that actually aid people with certain sicknesses. We're just here to support that sale or that knowledge gap. And so a lot of times, because the nature of our business relies on interactions with customers, consumers, or patients, it's very different on the phone. I think a lot of people think it's selling. It's not selling, it's data. But a lot of times people just want to be heard in a country where healthcare is very inaccessible to many, and so they become reliant on, I wouldn't say companies like ours, but the companies that we support to help alleviate their everyday problem. Because if you can talk to a doctor through some type of portal, but it takes you 3 weeks or more to set up an appointment and then pay a fee, and then hopefully they can discover something to help you, and then they have to sell you some type of drug to then assist you. It's a much longer process than just being able to talk to somebody over the phone. And I would say even for me, even though I support this industry, even I hate going to the doctor, because for me the portal doesn't work online or calling in for whatever reason, we're so behind that there's no real queue that you just stay online for anywhere from 30 minutes to maybe 3 hours to set up an appointment. So you know what? You just say, forget it.
You know, we've had a couple people who are on the show, and the conclusion that we came to, that exactly what your company was delivering was what this country needs.
Yeah.
And that's one of the great things about America, right? When there's a need, somebody's going to find a way to fill it and find a way to fulfilling that need for other people to build a profitable business around it.
Yeah.
And that's it. So what we were talking about was like people need basically care navigators, right? To help them, you know, understand what their needs are, what resources are available within the system, and help them get connected to the people who are trying to provide that to them. And it sounds like that's what your company is doing.
Yeah, and so we right now are focused on a lot of actually government bids. So usually certain cities or states, right, they get some type of funding, let's say 988 hotline, suicide, or I shouldn't say that, mental health hotlines.
Okay.
It's not, usually they go to, they subcontract that out, maybe to a company like ours, and then we can fulfill that contract. And sometimes we work with even other call centers to fulfill that. But all of that deployment of funds, it's not like the government agencies hire anybody in-house, right? They usually they manage it as a project, and then they work with companies or agencies like ours to fulfill that.
Gotcha.
Yeah.
Will cost incentives ever work out to where companies like that can be brought back in the U.S.?
I feel like the answer is always yes, right? Okay. If we work backwards from that, then we can figure out how we can make that happen. I will say personally, and I don't think I'm saying anything that's necessarily wrong, at the end of the day, the way people look at my business in particular is a call center. And that in other countries, that's seen as a valuable job, but the narrative within the US is it's not. And I think the perception of it is really what shrinks our ability to run a large enough operations. I have over 500 plus people. We're rather small compared to other companies in our industry. And so it becomes hard. Like even, I was telling some members of your team, I only have a few people in Nevada, in Las Vegas. I would like more, but it's interesting that I hear that the job market is tough. At the same time, it is really hard to employ the quality of people we need. And I think the only solution to that is to upskill the community and give them access to that instead of like, hey, you need to have experience in order to work here. Is how do we just give you that experience so that you're prepped for success so that we can bring that business in to, like my business in particular, to Nevada.
So I know the folks at the Las Vegas Global Economic Alliance are working with the city of Las Vegas to provide incentives for people to bring tech businesses here to Las Vegas to help our economy grow. So I'd be willing to bet there are people over there who would try to provide you with resources so you could find the employees that you need and to help you get set up and to provide you with additional resources, because we'd love to employ more people here in Vegas.
Yeah. I mean, there's enough people here. I don't think all of them have to work at the casinos, which there's nothing wrong with.
I've learned a lot today, and I really appreciate your taking time to be here with me. Is there anything that you think we need to do when I get to Washington and we're in front of all of the other legislators? What law do we need to pass, and what's the first thing that we could do to make America better?
I honestly don't think I'm equipped to answer it in the same way that you. I think
what would help your business to be better?
To be honest with you, I care more about the people versus the business itself. Okay. So if I had to choose, I would choose like my family or the families. Sorry, I'm not giving you a clear answer. Is whatever would keep me and my family here. Because at this point, at like better education or better healthcare, because in Vegas, until I see that change, I feel, I'm being very honest, I feel nervous of keeping my family here longer, or if there is a way for us to keep the kids here until like they're 18.
I want everybody in the legislature to listen to what this very bright and talented woman just said. She needs us all to solve these problems. Yeah. Let's get to it.
Yeah.
I'm Dr. Aury Nagy. I'm running for U.S. Congress for Nevada's 3rd Congressional District. I'm asking for your vote. Please look us up at nagyforcongress.com. Thanks so much for being here.
Thank you.
This podcast is a campaign communication paid for by Nagy for Congress and authorized by me, Dr. Nagy. The views and opinions expressed by guests are their own and do not necessarily reflect the views of the campaign or its affiliates. Discussions are intended for informational and conversational purposes only and do not constitute legal, financial, or professional advice. Any references to public policy matters reflect general positions and priorities at the time of the recording and are subject to change based on legislative process and voter input.